Dr. Owens, what is the damage on soft tissue damage when an auto accident occurs?
Okay, first off, let's talk about what soft tissue is. Soft tissue is the muscles, the tendons, which is the end of muscle, where it attaches into the bone, the ligaments, which are their supportive structure, which go from bone to bone, and the discs, which are the pads in between the bones.
Okay.
So, soft tissue damage can occur basically when you're hit. There's some variation, but your head can go, in most accidents where the person's rear-ended or front-end something else, the head goes forward and then backwards into a hyper, meaning too much flexion forward, hyper, too much extension going back. As we get into the too much, that's where things tear. Here you can see a picture of a torn muscle here, and that would be a very significant tear there. But these are the kind of conditions we see after car accidents. When the head moves backwards, these muscles can tear. Here is an example of a ligament that's torn, and this is the knife-shaped ligament that goes down the back when your head goes forward. That can tear. Here's an example of all little intricate spinal ligaments that can tear. When these tear, your spine loses some of its stability. And just like the ankle that you sprained back in high school, you always sprain that ankle. You always sprain it the same way. It's kind of weaker than it was before. Same thing can happen in your neck, and if the proper care is not given, it can really become a nasty situation where arthritis develops into the future because of that lack of stability. So the muscles tearing, the ligaments tearing, those are the main soft tissue things that we deal with after a car accident. We can deal, however, also with a ruptured disc, and if of course, if chiropractic care can't resolve that, your other options are on that or surgery. So it's always good to try the conservative approach first, your chiropractic care, your physical therapy, your exercise, moving into the more invasive things like surgery.